All right, hi, it's me, and I'm gonna do my presentation this way so you can watch it whenever you want, and also please disregard any screaming children or dogs that you may hear. Okay, here we go. So first thing we're gonna do is we're gonna play Diagnose with Dr. Google. I know y'all know how to play this because everybody does it all the time. So this was for when we were going to be in class, but you're going to come up with a quick diagnosis. It can be a medical diagnosis or nursing diagnosis. And if you have anything you want to share about it, post it to the discussion thread that will be with this video. So choose somebody from one of these case studies, pause the video, and go ahead and come up with a diagnosis for them. All right. So what did you decide? Well, I can't really talk to you or ask you at this moment. I'm pretty sure that more than likely all of us came up with something different because the symptoms are pretty vague and could be lots and lots of things going on. So let's start talking about somatic symptom disorder and what it is and risk factors for it. We're also going to talk about the history of a little bit, signs and symptoms, treatment, nursing considerations, nursing interventions, and then finally, I made a summary for you for studying for the NCLEX. So here we go. So what do witchcraft, sorcery, demonology, Egyptians, and unexpressed emotions have in common? So historically, somatic symptom disorder was identified as hysterical neuroses, and this concept of hysteria has been around for at least 4,000 years, and I know that several other people giving presentations, it's come up with them. Over the years, symptoms of hysterical neuroses have been associated with these things mentioned here, witchcraft, demonology, and sorcery, and also dysfunction of the nervous system and unexpressed emotion. They were historically viewed as primarily an affliction of, and if you guessed women, you're right. The basis of hysteria, which is related to somatic symptom disorder. Sorry. So this picture right here, this is Jean-Martin Charcot. He was a French neurologist and also a professor of anatomical pathology, and this is him presenting in front of the members of the neurological service that he worked with, and this is his, and I'm doing air quotes, pet hysteric, and her name is Blanche, and he's kind of just describing what's happening with her, but this is kind of this is hysterical neurosis, right? So the other picture is 1920, and you can tell that that's an x-ray. And they're pretty excited because you can see they can now see the cause of hysterical neuroses. And if you guessed that they're trying to look at the uterus in that x-ray, you are correct. So all jokes aside, I think that I'm only bringing this up because I think it's really important that even in 2020, women, and especially women of color, are at risk of receiving inadequate medical evaluation for symptoms because of how women are viewed in society. And I think that's really important for everybody to keep in their head as they go through this program. Just really quickly, too, some more history. Freud tried to move it away from the uterus in women, and that was not, people did not, there was not a good reception to that. But unfortunately, he tried to move it to the Jewish population. We kind of know the history of that as well. So what is somatic symptom disorder? So somatic symptom disorder is, there's a whole bunch of multiple syndromes that are sort of a part of this. They may or may not be associated with other medical problems. The change from the DSM-4 to the DSM-5 is now symptoms no longer have to be medically unexplained, but they're characterized by the patient having disproportionate excessive thoughts and feelings and concerns about their medical issues that they feel that they're having. And sometimes these symptoms are normal body sensations and there's nothing going on, but the person is interpreting them as pathology. The other piece of this is the person spends an excessive amount of time and energy and is devoted to worry and concern about the symptoms. And individuals with somatic symptom disorder are so convinced that their symptoms are rooted in pathology that they sometimes don't believe and could be even annoyed by the implication that stress or psychosocial factors may be a part of their condition. So again, one or more distressing somatic symptoms that's just disrupting their daily life, and they're excessively thinking about what they think is wrong with them. So that's disrupting their life. So here are the diagnostic criteria. And I just want to point out something that I didn't say before. Two things. One is that the persistent thoughts have to go on for at least 6 months and cause marked impairment during that 6 months. And also, most somatic symptoms involve pain, which is really important to know. So I talked really quickly briefly about related disorders. And so I talk about these a little bit. Somatization disorder is what somatic symptom disorder used to be called. Pain disorder is now also clumped into this somatic symptom disorder. And if y'all don't mind, I'm just going to say SSD because that's much easier. Illness anxiety disorder. We've all heard of this before because it's people who used to be called hypochondriacs. They're super in tune with every detail about their body, and they have fears that any tiny little change is a huge problem. Even when they're shown that there is no organic pathology, they might think that if they have a racing heart, they're going to have a heart attack. And their primary fear is just focused on the fear of being sick. Conversion disorder, it's neurological, so it's sort of like SSD, but the person can actually go blind, become paralyzed, or have other neurologic symptoms. And when they're evaluated, there's no medical explanation for them. And so I read one thing that said, it was an example. It said, imagine if you're in a car crash and afterwards you couldn't physically move your legs, even though there was no damage within the crash. And that would be an example of conversion disorder. Body dysmorphic disorder, and then facetious disorder, we probably have heard of it before as Munchausen's. Here are the changes in one handy dandy little chart. So you can see, like I said, somatoform and somatization disorder, they're now kind of clumped into this SSD. The difference is there's mild to moderate and then severe and persistent for 6 months. The illness anxiety disorder has been renamed, and then conversion disorder is the same, and pain disorder is now identified as SSD with pain as a specifier. So we're actually going to meet people who are affected by somatic symptom disorder. We're not really going to meet them, right? And they're not really real people, but they are actors acting out real people's symptoms. So this is Matthew. He's 11. He has recurrent syncope, and he was asked by his principal not to return to school. This is Anna. She's 16. She has debilitating headaches, and she feels like her life is going on without her. So here they are.
know it's hard to look back, but your story might be helpful to others.
Basically, if I think back, it started with these like crazy headaches, which was weird because I'd never had headaches before.
What happens is that I pass out all the time. Before it used to happen like 50 times a day. That's why the principal told me I couldn't come to school anymore.
Can you tell me what your first visits to the doctors were like?
I was going to a lot of appointments, and I went to emergency a bunch of times.
They like sent me for a bunch of tests and like CAT scans and stuff.
And what did they say?
They all said it was something different. One doctor said it was a sinus infection.
I was really confused as to why I was sick.
I knew my parents were really worried that it was something bad. I was scared.
Scared of what?
Maybe I might die or something.
What was your life like at that time?
Like the way I see it, my life kind of stopped when I was sick. All I wanted to do was be in a dark room 24/7. Like another thing that I had to accept was that life was going to go on without me. You know, my friends were going to keep going to parties and going to movies together, and they were going to continue to hang out even if I wasn't there.
And what about your family?
My family sympathized with me, but it was really hard to connect with them at that time because no one had been through something like that before. It's not like a cast on your arm that can show people what's wrong. When it's in your head, how are they supposed to know when you're in pain? And so you have to communicate that with them, but sometimes your words just don't work. So, I don't know, I kind of felt like nobody really got what I was feeling.